Diagnosing familial Mediterranean fever can be a complex puzzle, often requiring a combination of clinical evaluation, genetic testing, and careful exclusion of other potential conditions. There is no single test that can definitively diagnose FMF, making the process reliant on a comprehensive approach. The first step typically involves a thorough medical history and physical examination. The doctor will ask about the patient's symptoms, their frequency, duration, and any triggers that seem to precede the attacks. Family history is also crucial, as FMF is hereditary. If a close relative has been diagnosed with FMF, the likelihood of the patient also having the condition increases significantly. Genetic testing is another important tool in diagnosing FMF. This involves analyzing the patient's DNA to look for mutations in the MEFV gene. While finding a mutation provides strong evidence for FMF, it's important to note that not all individuals with FMF will have identifiable mutations in this gene. In addition to genetic testing, doctors may order blood tests to look for markers of inflammation, such as elevated white blood cell count, erythrocyte sedimentation rate, and C-reactive protein. These markers tend to be elevated during FMF attacks and return to normal levels between episodes. The chameleon-like nature of familial Mediterranean fever often leads to misdiagnosis, as its symptoms can mimic a wide range of other conditions. This diagnostic dilemma can have significant consequences for patients, leading to unnecessary treatments, delays in appropriate care, and increased risk of complications. One of the most common misdiagnoses is acute appendicitis. The severe abdominal pain characteristic of FMF attacks can be easily mistaken for this surgical emergency, leading to unnecessary appendectomies. In fact, studies have shown that a significant percentage of individuals with FMF have undergone appendectomies before receiving a correct diagnosis. Another common misdiagnosis is inflammatory bowel disease, such as Crohn's disease or ulcerative colitis. The abdominal pain, diarrhea, and weight loss sometimes seen in FMF can overlap with symptoms of inflammatory bowel disease, leading to misdiagnosis and inappropriate treatment with steroids or other immunosuppressants. Rheumatic diseases, such as juvenile idiopathic arthritis, are also frequently mistaken for FMF. The joint pain and swelling that can occur during FMF attacks can mimic the symptoms of these conditions, leading to misdiagnosis and potentially harmful treatments.